Things are really changing rapidly as far as the best way to operate your dental office. So let me make a little short video here about some of the things that we see that we think are real game changers in dental practice management. Hopefully your operatory doesn't look like this anymore, and you can't let your practice management look like this either. There's lots of different dental software on the market. Keep in mind that the software that you use determines what you can do in your office and how easily you can do it. That's the reason why we only consult with offices either using Open Dental or switching to Open Dental. And the examples I'm going to show you are using Open Dental, but they also apply to a certain extent to other software as well. I will warn you that a little setup is required, maybe not quite this much setup, but a little setup is required in order to get Open Dental to do the things I'm going to show you. Let's talk about recall. We work really hard trying to get patients in the front door, but then often we just wave goodbye to them as they go out the back door. We don't want this to happen that way. Open Dental has a feature that we call auto recall scheduling. With a click of a button, it jumps out into the future the right number of months until Donald will be due either for his perio maintenance or for his prophy. It knows the difference. It knows the other procedures that will be due at that appointment, in this case 4 bite wings. It knows the length of the appointment, and it knows the preferred provider for Donald. It's giving you choices down at the bottom for different options. Very fast, very easy, much easier than counting on your fingers and trying to figure out what procedures are going to go into that appointment. Even better, Open Dental can totally automate this process. So it automatically sends out emails or texts with a link, and nobody else does it this way. So the patient can schedule their own appointment right where you want them to schedule. Again, it knows what procedures go in there, who the provider is going to be. When the patient clicks on that link, it opens this little calendar offering dates and times that are available, and the patient just selects the time that they want. And the patient schedules their own appointment into open time slots that you've selected. No two-way texting, no call in the office. This is all done by the patient. It allows your office to be open 24 hours a day, 365 days a year for patients to make their recall appointments. We've seen this benefit every office that's used it. This is different than Yappy or LocalMed or some of the other scheduling services. This is totally automatic. Patients do it 24/7, schedule their own appointments, and allows you to recapture some of that lost opportunity out there. This is a major game changer in my opinion. Another game changer in scheduling is what Open Dental calls the text ASAP. So you've got a hole in your schedule there. You right mouse click on it and you get this text ASAP window that then gives you a selection of patients that you can text and or email with one mouse click. Similarly with the recalls, when the patient clicks the link, they get this little calendar, but this only offers one appointment for that hole that you have in your schedule. Just like with the recalls, the patient does the work and fills the holes in your appointment book with a couple mouse clicks by the staff. How about better, quicker ways to chart? Most of the time, the auto notes are the fastest and easiest and most complete way to do your charting because it actually acts as a little checklist so that you don't forget things. Open Dental has a new feature called a dashboard that we can kind of hijack into a paperless routing slip by doing a little customization. So this is user customizable. It lives over on the right-hand side of the screen in all the Open Dental modules. So when you're in the appointment book, you see this patient. When you're in the chart, you see this patient. It moves with the patient from module to module. Just as with a paper routing slip, this has a whole bunch of useful information. Does this patient have a recall? Do they have a next appointment? What about their family balance? Do they need to be pre-med? Do they have an email in there? How about their cell phone? Who referred them? Is that where they still live? How about unscheduled recalls for other family members? How about treatment for this patient that's not scheduled? There's no excuse not to know this information when you have it right in front of you in each module in Open Dental. The paperless routing slip is just an example how it's much easier to manage your patients. This really is another game changer. You can improve your over-the-counter collections by having the patient's estimated portion displayed right in the appointment book. We want to be able to enter treatment very quickly so the chairside and charting can keep ahead of the doctor in dictating. So we're just going to pick a tooth, pick a surface, and then we're going to go in and pick a material here real quick. In this case, it's composite. So very fast, and the right procedure code goes in there. If that was in an anterior tooth, it would have picked a different procedure code. Now let's do an endo and a crown on two different teeth here. One's a bicuspid, one's a molar. So we'll go into our quick entry, our frequent ones here, and right there we have the endo buildup in a PJC. If we click on that, again, it puts the right procedures in there for us. It knows the difference between a molar endo and a bicuspid endo automatically, and it puts a seat in there for us too to help us when we schedule. Let's do a bridge. Donald's walking around with no teeth. We just select the teeth. We'll go over to crown and bridge, and we can do a porcelain bridge or a PFM bridge. I'll do a PFM bridge here. It knows the codes. It knows what a ponic is. It knows what a retainer is. It puts all the codes in that fast to schedule a bridge. All right, let's look at tooth number 19. Okay, we can do a bridge down there just like we did before. We'll do a PFM bridge in this case, different codes in there automatically. But let's do some alternatives here. That's one alternative, but it's nice to be able to quickly enter other alternatives. So I'm going to create some other treatment plans here. Let's do a treatment plan for a lower partial. All right, so now we've got the treatment for a lower partial. Let's pick all those teeth. We might as well put the anterior teeth on the partial too. We'll go into our removable section here, and we'll click on the RPD. It knows the arch, it knows the teeth, and it automatically added those other procedures to help us when we're scheduling. So very fast and very easy. Let's do one for implants. Implants are pretty hard because people don't know the codes. Well, you shouldn't have to memorize a whole bunch of codes. So let's just label this one implant. We'll go into our implant surgery here because we're going to place the implant, pick the tooth. Now the first implant is going to include a cone beam and a guide. An additional implant wouldn't do that. Now we're going to have to add the prosthetics. Let's go into prosthetics and let's do a single crown. Boom. Okay, there's all the correct codes in there. So now I have three different alternatives in here for Donald Duck. I've got the fixed bridge, I've got the lower partial, and I've got the implant. When I go over to the treatment plan module, I can easily present these to Donald. Say, Donald, here's the fixed bridge. Your portion would be $2,000. We could do the partial instead, and your portion would be $728. Or if you want to, we could do the implant. So what I did was very quickly enter different treatment plans, but also enter alternative treatment plans very quickly. So I can present alternatives to my patient and hopefully increase case acceptance. Embracing these game changers in modern practice management should help make your office more efficient and more effective in the age of managed care. This should help you improve your patient care, make everybody's job easier, and improve the practice profitability.